James, remind me, is there a pill to get people to exercise?
There's no pill, but there is a brain implant.
Intrathecal cardarine pump?
It's called a Neuralink. And I want
Interesting.
to patent it to make people exercise. Because in theory, if you can interpret the brain signals and put those to the body, you can capture someone's brain signals that they would be having during exercise and force someone to exercise.
Can we test that on our employees? I mean, our lab rats, or should we just pay them to exercise?
Right now, probably more logistically feasible to pay people, just like you get them to lose weight. Or what was the other thing you said we pay people to do to get
Quit
them
smoking.
to be healthier?
Yeah.
That's right.
Yeah, money actually works quite well to quit
just
smoking
make
or lose weight.
Cigarettes so expensive that no one can afford them.
Yeah.
We should do the same thing with orange soda. People love it when I say that.
They do. They also love it when you talk about taxes, but let's avoid that so that we can get more like buttons.
50,000
on this
people
episode.
just stopped watching.
Yeah. So we actually did pay our employees to exercise, and we all did the military fitness test. And we will dive into that and more on how that went on today's episode.
Welcome back to the Gillett Health Podcast, where we give you tools to develop a balanced approach to health and not medical advice. My name is James O'Hara, and I am a nurse practitioner.
And I am Dr. Taylor Martin, DOMPH, preventive medicine expert in disguise. But in actuality, I'm just wearing a mustache today because some other things, like PPAR Delta agonists, are now wearing a mustache as PPAR Beta agonists, which we'll talk about at a different time.
You're really getting into character there. That's exciting.
I was trying my best.
You came dressed up as a SARM.
I don't have the blonde hair, blue eyes, and what is it? Surfer skin?
The California tan.
Yeah, the California tan. Don't quite have that down, but certainly working on role playing with that.
Today we're going to be recapping the Gillett Health Games, which was just essentially a modified Army fitness test, the ACFT, and some people maxed it. One person maxed it. Most people did not. So tell us a bit about that. So you maxed the test again, got a score of 700?
Yeah, it's really too easy. It's supposed to be a score of 600. But in the lead up of this employee health event, we were doing it to incentivize employee health. If you finished all the events, even if you didn't score, then you would get a prize, monetary prize. So works well for losing weight and quitting smoking, and also works pretty well for incentivizing exercise among employee workforce. But yeah, I do want to mention, even when my only PED was creatine, I could still max this test. But training for it helps quite a bit. The more you do the events, just like anything else, the better you will be at them. We have an accountant, an employee, I guess, who is particularly strong and with great cardio, and some things like throwing a ball, he just might not be very good at.
Yeah, that one was actually very close for me. I got probably a few inches past that 15-meter mark, but I'd never done the medicine ball throw prior. I just happened to, after I think it was my third attempt, I figured out the technique and was able to max that event. So when we repeat this next year, but probably a week before, go out and just do a day of technique, making sure I've got it down.
For sure. Yeah, Mrs. Gillett can give you some tips if needed. Yeah, she did the whole thing pregnant too. When she's not, between her second and third trimester of pregnancy, she can max every event, which I think is a good sign that it is relatively age and gender neutral, which is why the Army and the military has implemented it, is because it's supposed to be age and gender neutral.
Yeah, and most of the events are strength-based, so you could get a very good score with being just a strength athlete.
Yep.
But the 2-mile run, which we shaved down to 1 mile, much to the appreciation of our employees.
Yes.
That's the one that would be limited if you were primarily a strength athlete or not historically a runner. So that was actually my Achilles heel, although my Achilles has been fine. It was actually a soleus issue that I worked through. I ended up with a mile time of 7:11 after a prior best last year of 8:39.
Yeah.
But I've really never been a consistent runner up to this point.
Yeah. Not too bad. Definitely. That's what brought your score down. You certainly would have maxed all the events with a little bit more running practice and time and less soleus injury. The soleus injury is probably from all that CrossFit that you've been doing.
Yeah. Well, and I don't know if I could call it an injury. Depends on how you define an injury. Probably didn't help that I started running right after my peak bulk weight, 197. And running slow is, to me, boring. So I was doing a lot of 400-meter repeats, so higher intensity work without a true running foundation. I figured, doing squats and deadlifts and Bulgarian split squats and lunges and having good hamstring and glute strength would sort of injury-proof me. But I think it came down to maybe some ankle instability.
Yep.
And then some tight gastrocs that were causing my soleus to also be tight and get overexerted. So I worked through some physical therapy, took a few weeks off training. I don't think that 2 weeks of training would have got me to a 6-minute mile from 7-Eleven.
Possibly.
But next year, I'd probably be close to 6 minutes. I don't know if I'll go below 6 minutes.
Yeah. And to be clear, so what we did is normally the maximum score for 2 miles is 12:45. So after that feedback from employees, we took the 2 mile down to a 1 mile, and then we just cut the time in half. So half of what would be 12:45 is 6:22.5, which is the max score. So you were pretty close to the max score. But we also added that 500-meter row, which is more biased against heavier athletes rather than lighter athletes to balance out the run. And honestly, I think that the military should do that.
Yeah, the row was a fun addition. I guess we can kind of just read across and put this up on the screen, our scoring for the males and females. We can probably put these up side to side, but for what's relevant to us is the hex bar deadlift, so 3 reps with 340 pounds. And this was to the radius or the midpoint of the plates. So it wasn't the elevated handle version, which would have been substantially easier.
Correct. Yep.
And that was much to the dismay of our employees because I think the trial run was handles elevated,
handles,
built up confidence.
Yep.
But people still did really well.
Yeah. A lot of these events are designed to be lower injury risk. And if you look at less trained lifters, a hex bar or trap bar deadlift has slightly more quad activation. And people tend to be better at using their legs with that than with a traditional barbell deadlift. So I do think that that's a good addition for the military, although they should probably allow slightly better warm-up. So they don't really. Yeah, I don't know what the warm-up situation is.
You talked me through this. You said that they're usually doing all of these within an hour.
Yeah.
So you don't have a lot of time to warm up and make sure everything's firing properly.
Yep.
But we'll talk through injury risk a bit later. One substitution we did was we took out push-ups. Yep. And we did for the men, either incline barbell bench press or incline dumbbell press. Mm-hmm. And the women did push press.
Yep.
Is that correct? Yeah.
Yeah. So this is really the only thing that was gender separated whatsoever. Maybe in future years, we can find a way to simplify this to some degree. But certainly touching a dumbbell or barbell to your chest, going up to lockout, or touching a barbell to the top of your chest and then go into a lockout, a lot easier to judge than a push-up. And you're also not trying to do 60 of them in X number of seconds.
Yeah, this is more of a strength boot. This was probably the single easiest event for myself. It definitely feels like I exerted myself less on the incline barbell or dumbbell bench than the deadlift.
If I was truly trying to get an idea of military fitness, then yes, this applies to some degree. But if you really wanted to do something, then I would have people put on a weighted vest to simulate like a plate carrier, something like 30 to 40 pounds, regardless of your body weight, and then have them do burpees for time. So how many weighted burpees to target? So you would touch a target. So you simulate you're in a trench in the military. You have to get down all the way in the ground, taking cover from shrapnel. straight back up, put the ammo
throwing
can
a
up
grenade
top,
over,
throwing a grenade, and then straight back down. So, and you do use push-up power to some degree. Yes, you can cheat burpees CrossFit style and just kind of flop and bounce, but and there's some technique to it as well. But if this was truly for functional fitness, then I would add that. Yes, they do have, I guess, half of a burpee at the sprint drag carry, but it's really not enough.
Yeah, it's getting up once.
Yes.
So it's 1/2 burpee, exactly. Mm-hmm. Yeah, and that's we have the hanging knee raises, 20 reps. This one I would say is moderately challenging because it's, for most people at least, it's going to be somewhat uncomfortable once you get past a certain number of reps.
Yep.
So, getting your knees to elbows 20 times, you'll probably feel a bit of a burn there. It's going to be a little bit challenging. A lot of people did well. Some people did their very first hanging knee raises, which was great.
Yes. So great for core strength, great for grip strength. I love this exercise. Much better than the plank. We thought about doing the plank and then we nixed it. So in the real ACFT, which they might get away with completely, which is ridiculous considering how much equipment they purchased from Rogue, but not to get into that, they wanted to do the plank instead of the hanging knee raises, which does not seem like a good substitute whatsoever. Plank is more just how much pain do you want to go through, which does have some merit.
Yeah, but much less technically challenging, and it doesn't truly unmask a deficiency in grip strength or core strength.
Yep, it's not going to. You have to have a stronger core to do a hanging knee raise than to do, a few seconds of a plank, I guess.
Yeah, I would agree. Then we have the sprint drag carry, and there's more to it than sprinting and dragging and carrying. I can never remember the order of them, so I'll let you talk through that one.
So it should be called start prone, so laying on your stomach, stand up, sprint back 25 meters, I believe, and then sprint back 25 meters. So the whole thing is 250 meters. So it's less than a full lap around a track. So sprint, touch the line, sprint back, and then drag a sled, touch the line, drag the sled back, side shuffle, which I do think is a great functional movement, strafing or whatnot. It's balance. People can fall over during this time period or almost fall over. Side shuffle back, carry back, sprint back. So it should be called the sprint, drag, shuffle, carry, sprint. And I would leave this event just as it is, but depending on how soft the grass or turf or surface that you do it on, there could be a lot more or less friction. So standardizing for how much friction or weight, perhaps they always do this on turf fields, but not all turf fields are the same.
Yeah, that would make sense. So you have a consistent environment to do the measurement in. Mm-hmm. The next is the 500-meter row. And this is one that I don't think I'd ever used a rowing machine until the last 6 months. Mm-hmm. But it's actually kind of fun. I like the Concept 2 rowers that are at the gym, and managed to go just under the 1 minute 30 time threshold we set for the 500-meter row.
You had 127 or something like that.
128.2.
Yeah.
So my strategy for this, and your advice, maybe we rowed on too high of a resistance in hindsight.
Yeah, you don't want to row too fast.
But the first 5-6 strokes out of the gate, really get the thing spooled up, get going, and then sort of back off just a little bit, and then the last half or 40% you could pick up the pace again, and that one worked for me. I did not fall off the rower like I did on the test day.
Yep.
So that was pretty good. Maybe if I was going all out, I could have gotten a little bit closer, maybe a 125.
Yeah.
But also, like you pointed out in the strategy of doing all of these events within, I think we did in about 2 hours. Mm-hmm. You don't want to completely gas yourself out on one event at the expense of others.
Yep. No, it's a good way to think about it. With the 500-meter row, I just took it as easy as possible. And I think Derek and I both rode something like 125, but we really should have taken it a bit more easy. So although I guess it didn't matter, we both maxed the mile after.
Yeah, max the event, max the mile.
Being a heavier body weight is a huge advantage, and being taller is a big advantage for the row. So when I'm in the 230s, I'm a little bit lighter now, but if I'm in the 230s, my PB is 119, whereas it's definitely not that fast, even if I was going truly all out right now.
So how heavy would you have to get to beat the world record? You're only Your personal best is only 10 seconds off.
Depends on the age group. So unfortunately, I'm still 33. It goes by every 5 years. So 35, 40. I would probably just have to get older. I don't think that I could ever get the world record of 109, I believe.
Yeah, it's pretty crazy.
I think the doctor record is, I don't know if Sean Baker rows 400s or 500s, but he is also a good rower.
And they have, so he's the record holder for physicians, and at least in his age category.
In his age category. Because I do think I could beat him rowing, or at least be close. It'd probably have to be when I was in like my winter or heavier phase, rather than a running phase.
Yeah, because he would have a pretty big weight advantage. I think he's about 260.
260? Yeah. So even if I was bulked up, you'd have solid 20 pounds. So, but my cardio and VO2 Max is also going to be pretty good. So
that's true.
If it was a 1,000 meter or 2,000 meter, that would definitely be advantageous. But anyway, regardless of if you're male, female, you max the row points if you row a 130. And we just came up with that arbitrarily by subtracting 10 seconds from the sprint drag carry. So the 500 meter row is not an actual ACFT event.
Yeah, this is one of our add-ins, and it'd be a reasonable addition. I think the injury risk on that is pretty low, especially people set lower resistance. So I rode on a 7. Realistically, it probably should have been, a 5 or 5.5, something like that.
Also, shout out to Mrs. Gillett for being 30 years old and rowing a 126, which is the world record in her age category. So good job to her. The last event is the 1 mile run. And we kind of already discussed this. We cut it in half. Yes, a 6:22 1 mile is way easier than a 12:45 2 mile. So.
Yep. And you came in under 6 minutes. We had one other person that got a 6-minute mile, and then myself and one other guy, I think he was like 7:10, then I was 7:11.
Yep.
So yeah, if I would have shaved off 1 more second, I would have got 1 more point.
Yeah.
But not something I was really thinking about. I was just tracking my pace, and I was like, hey, I'm going to be at least 30 seconds faster than on the practice day.
Yeah, I think I jogged a 5:31, which certainly running together in a pack helps quite a bit. I, of course, used to be a runner, which is a massive advantage because I actually know how to strategize and run a mile. I've run it under 4:30 plenty of times. So 5:30 or under 6:22, I suppose, is not too bad. But at some point, most people are either a good rower or a good runner. And I feel like being a good mix of the two has a lot of merit when it comes to your body weight to power output or cardiac output ratio. And if you're talking about a body weight to cardiac output and, oxygen intake ratio, you're really talking about a VO2 max.
Yeah. And rowing is a nice balance to that because your highest VO2 max athletes, so think of a elite marathoner. They may weigh, 120, 130 pounds. They're probably going to struggle with the row.
Yeah, not going to be a great rower.
Not because they get tired.
Great for their
because
body
their
weight.
strength.
Yeah, they do have
decreased.
Weight categories in rowing. But, I suppose if you were in the Viking military 1,000 years ago, it's just how good of a rower on you.
He's a really good rower for 120.
For the weight. It's like, well, give me one of those Thor. I wonder what Thor could row. He could probably row a world record on his first try.
He's probably someone where the damper setting doesn't go high enough.
It's like he needs a 20 instead of a 10.
Yeah. Now, that would be interesting because he very likely could set the world record just with the power output, a little bit of technique work.
Yeah, because his cardio up to about, a minute is probably
the
good.
strongmen have surprisingly good cardio.
Yeah. Well,
relative to their strength.
Yeah. Cardio for strongman is like 60 seconds, which is impressive. Because if you think about a lot of strength athletes, certainly Olympic weightlifting, power lifters, they have no cardio whatsoever. So their cardio is impressive. So if I weighed 400 pounds, I would have a difficult time walking for a minute straight. So
that's true.
Yeah, shout out to strongman for sure.
Yeah, but now talking through injuries, what a injury is. So you mentioned that you had a tweak of your Achilles. It's not injured.
Yep.
So I looked at a couple of studies. We had actually pulled these from CrossFit studies showing that they don't have higher injury risk than comparable activities like rugby. But one definition was injury sustained during training, which prevented the participant training, working, or competing in any way and for any period of time. So that's a pretty loose definition that's going to be very sensitive to any injury or even tweaks.
Prevented from training, working, or competing. I would say, although I've probably been injured 6 or 7 times in the last 6 months, 6, maybe even 9 months ago is when I really turned up the intensity with my high intensity style workouts. And the first 6 months that I did this CrossFit style, not CrossFit training, no injuries. And now I've still had no injuries, but I've had a lot of tweaks.
Have those tweaks altered your training, competing in any way for any period of time?
Kind of, but
that sounds like
I'm
a yes.
more of like a glass half full. So if I was taking the survey, I'd probably put a no. Because I haven't missed
It
any
was just a
competitions.
questionnaire.
I would probably put a no.
Gotcha. So this is very subjective. And even with it being subjective, it was like 74% of CrossFit athletes reported an injury by this definition, which is, again, pretty sensitive if you're looking for injury.
So 73% were on PPC 157.
Oh, only 2.2% of CrossFit athletes reported PED use.
That's not a PED.
It's on the WADA banned list.
My TRT and my BPC and my SARMs and my peptides and my GHRP are not PEDs. Those are my supplements and peptides and medications.
Supplements.
Yeah. They are not. I do not do any drugs, and D in PED stands for drug.
Yeah, it was an interestingly
no response to that.
Low percentage of CrossFitters, because if you go to I think they've done these similar surveys in commercial gyms, and it's like 10% or something that gets reported as like, they're like, oh yeah, I do some gear, I've run some cycles, that kind of thing.
That's because they're actually big enough to not be ashamed to say yes.
Yeah, that pesky cardio does get in the way of gains at an elite level.
Yes, when you're doing cardio when you should be strength training.
Yeah, if you're trying to be a professional bodybuilder, or if you just want to be a gym rat.
Yeah, cardio is pesky because it can help you live longer and have a better time in the gym. Maybe at some point when you're already past, let's say actually we don't even need to put a weight on it, but if we want to put a weight on it, you're past 2 plates in the bench, 3 plates in the squat, 4 plates in the deadlift. You're an intermediate lifter as a male. And as a female, say you're past 1 plate in the bench, 2 and 3 or whatnot, not perfect conversion. But other than for being a hobbyist for health reasons, you're probably not going to be osteoporotic if you're lifting those sorts of weights. And you're also likely going to be able to have enough baseline strength to function pretty well from day to day.
Yeah, and I think there are people on both sides of the spectrum that are unbalanced, right? Too far in the strength training, too far in the cardio side of things. I mean, 5 years ago, I was extremely unbalanced. I did like only strength training. I was lifting. I was like, cardio doesn't matter. My body composition's good.
Yep.
Realistically, if I was like introspective and thinking about it, I'd be like, yeah, that's probably not true. Yep. But that was what I was thinking at the time. And, I was familiar, just like you during residency, listening to Dr. Peter Attia. And at the time, my mindset was kind of like, I'm not going to listen to this stuff about VO2 Max. This guy doesn't even look like he lifts. But as time has gone on,
probably pretty good VO2 Max.
I think he does have a pretty good VO2 Max. He was a distance swimmer, cyclist, a pretty elite athlete.
Yeah.
But as time has gone on, I've, and in discussions with like further learning in the literature and with patients, I've come around to that. I've probably been doing cardio pretty consistently since 2020 in some form or another.
Yeah. Well, the CrossFit Medical Journal told me that VO2 max does not matter and is not the gold standard. But Peter Attia told me that it was. So I don't know what to make of that. I certainly would tend to go with something that Peter says over something that the CrossFit Journal says. Partly because aren't CrossFitters kind of notoriously not super high on VO2 max for elite athletes?
They hold the title of fittest person on earth, right? If you win the CrossFit Games, then you get declared fittest on earth.
Isn't there an
TM.
asterisk that says fittest person on earth that is a gymnast or Olympic weightlifter?
Is that what the TM stands for?
I think that's what the TM stands for. I know they sue a lot of people who try to
call themselves
infringe
that.
in any way. But yeah, and I mean, there's obviously merit to CrossFit. I regularly go to a CrossFit gym and I do a whole bunch of local competitions. Our company, which I guess is you and I, gives money and sponsors these competitions.
Yeah.
So it helps a lot of people do healthy things. But from the science standpoint, I think it's kind of ridiculous to say that VO2 max should not be the gold standard. What they say, maybe to steel man their argument, I guess, or, try to play devil's advocate. They say, well, anaerobic capacity should also matter and we should measure that. So I guess they're kind of doing like a straw man argument where they say VO2 max is a poor measure of anaerobic capacity, which it's never trying to measure in the first place.
Yeah, I guess if they're talking about using VO2 max as a sole predictor of fitness or balanced fitness, like towards longevity, which I think is what a lot of people are exercising for, because it's fun, you're going to be healthier, probably going to live longer, then strength is going to become more important, especially as you increase in age. Of course, you still want to have some reasonable VO2 max, but strength, if you think about, if you can be in a great aerobic shape, but if you get a hip fracture because you're not strong enough to have enough balance to mobilize and ambulate properly, that's a problem. So if VO2 max is not the gold standard, what do they propose as the gold standard?
150 wall balls. And I am not kidding.
Yep. This is actually the last paragraph in the study. I guess this is a little bit of an opinion piece, and it's from, what year was this?
Along 2006. It's pretty old.
But yeah,
it's not archived yet.
I'll read this. It says, not a runner, because presumably you can do a 12-minute run test. I think Dr. Andy Galpin has even talked about this. If you're a habitual runner, it's a pretty good proxy for your VO2 max. So they say, well, if you're not a runner, test yourself at 150 wall ball shots for time. If your time over the year decreases, your VO2 max has improved, and that's good to know. However, you must be able to sustain any movement you want to test VO2 max continuously for about 6 minutes or more. If a wall ball with a 20-pound ball overloads your arms so that you have to break sets and rest, it wouldn't be the best choice for VO2 max. Use a lighter ball, or maybe even adding to the number of shots so you can work continuously for 6 minutes would make it work as a test of your wall ball VO2 max. That's a term that I'd never heard before today.
And nobody has ever heard since either.
So for anyone thinking of getting an expensive fitness test done, what does a VO2 max cost? About
$0.
$80?
Oh, if you do it at like DexaFit?
Like if you do the actual oxygen capacity,
a bit more expensive.
With the mask.
Yeah.
But yeah, a 12-minute run test, I mean, that doesn't really cost anything. It could cost $0.
Yep.
They said, spend your money on useful things like the CrossFit Journal, or another medicine ball, or another set of rings so your friends can join you in actually improving your fitness, rather than worrying about how to quantify it.
I understand what they're saying. And again, to steel man their argument, they're trying to say, don't ego run. So a lot of people ego lift. You shouldn't ego run. If you're running so that you can flex on a CrossFitter who is more well-balanced than you about how your higher VO2 max, then that's not a good reason to run. Just like if you're bench pressing so that you can flex on CrossFitters' ridiculously low bench press numbers about your incline bench or whatnot, that's also not a good reason to lift. So I think that's a good takeaway from the article. I feel like you and I are both more than willing to provide our services to any sort of CrossFit organization if they want to put in perhaps some more academically or clinically worded
Like maybe
articles.
a VO2 Max update for
Yeah.
2024.
Update, use VO2 max for aerobic capacity, and then use X for anaerobic capacity. Or we could talk about Andy Galpin's fitness test.
Yeah, that's a pretty well-rounded test as well. But I think there may be some merit to this last sentence they had there, talking about just actually improving your fitness rather than worrying about how to quantify it.
Yes.
I think measurement can be useful, but a lot of people are sort of majoring in the minors. There's a lot of talk about zone 2 versus intervals and what do I do? And some people will have like analysis paralysis, or they might not be training hard enough because they don't want to get out of zone 2.
Mm-hmm.
But for most people in the population who are relatively untrained, it doesn't matter if you accidentally do some zone 3 cardio, you're still going to get in better shape.
Yeah. No, that's a good summary. The majority of the population, not necessarily watching this podcast.
That's true. Yeah, I should caveat that.
But the majority of the American population can do anything without getting overtrained. However, if you're a relatively elite athlete, then you should know your body enough to where many athletes do not need to use, for example, HRV for looking at recovery. A lot of times it can confirm something that you already know. But you should also know your body well enough. For example, if you are an elite female marathon runner, then you do probably want to train in a lot of zone 2, even though popular influencers might say zone 2 does not work for females.
Yeah, there's a lot of misinformation out there. And I think most people that get to an elite level, they've gotten there intuitively. I mean, there's a big genetic component, but they also sort of know how and when to train. And they've probably had some good coaches along the way, some bad coaches along the way, and sort of think, okay, when I tried to do this, I was, not improving. So I'm going to sort of take the good bits of everything that I've learned and carry that with me, which is why a lot of them start coaching programs.
Here's something that I will add to the discussion, which I think most experienced coaches would agree with, regardless of if you're male or female. If you are lean for your genetics and body weight set point, for example, some males can train and perform great down to like 7% body fat, Nick Bare. Some males cannot, like perhaps Mitch Hooper, the strongman. But some people just have a different body fat at which once they go under that, they are much better off doing more zone 2. So in general, the leaner you are, the more zone 2 is going to help, and the more of a caloric deficit you're in. So let's say you're a CrossFitter doing a bunch of high intensity exercise and you plan to lose, that last 10 to 15 pounds, which almost everybody is always losing that last 10 to 15 pounds of body fat, right? It's like this summer is the summer I am going to
just
get
that little bit, that last little, the spare tire.
at the bottom.
Yeah.
And when you're doing that, you are going to be much less overtrained. Again, we're talking about elite athletes. If you do more zone 2 during that time, or use the principle that our friend Jeremy gave, and that is 2 workouts a week are the workouts where you really push it. Whether you're saying, this is where you, get into a really high RPE if you train based on RPE, or whether that's when you're having your like more neurologic stress days, for example, leg days, if you're primarily a strength trainer, or whether that's your, if you're more of a runner, that's your tempo track day that's hard and not your zone 2 day. So I think that's a good rule of thumb, especially if you're lean or going into a deficit.
Yeah, it makes a lot of sense because up to a certain point, putting in more effort and fatiguing the nervous system more is going to increase risk for injury. And then you risk taking a step back when you have to modify your training. If you are meeting one or more definitions of injured.
Yep. Another nice thing that elite athletes can look at, or just athletes, depending on their discipline, is what can you expect from a VO2 max standpoint? So as we mentioned, you can measure it running, rowing, and then cycling as well. You can measure it a lot of different ways. But those are kind of the three main ways. And earlier today, I thought it would be fun to ask you what you thought the highest VO2 max sports would be. For example, like CrossFit or tennis. And you pretty much had all the top 5 down.
Yeah, I missed running. I said, cross-country skiing, rowing, and I think I said cycling.
Yeah.
But the middle two you said were actually long distance and middle distance running, which are both running.
And this is from the movement system. We'll post this in the podcast as well. But that was very interesting. I was surprised to see race walking so high. So in general, the VO2 max for males runs about 10 points mils per kg per minute, higher than for females. But I guess no huge surprises in those kind of extremely high and very high sports. Of note, High Rocks is not listed here, but I do believe that it would kind of be in the low 60s. So given that High Rocks is an 8K and my lifetime best running VO2 max is 70, I have a hard time believing that, top or elite High Rocks athletes would not be able to get close to matching that.
Yeah, well, because there's also not cross-country skiing, but they use the ski erg in High Rocks. So you've got running and skiing.
And rowing.
Built into the competition.
Yep, and there's a lot of running too. A wonderful channel, I suppose, YouTube channel, WOD Science, did a post about how High Rocks athletes are taller and have higher VO2 maxes. And it was extremely entertaining to read the comments of that post.
Yeah, I really like that channel. It's interesting. It's engaging. A lot of people don't like the data. It reminds me of BioLane's t-shirts that say data over feelings or data greater than feelings, because people are like, well, of course, because someone is, CrossFit, that it's better than X, Y, or Z, whatever other training.
Yeah, CrossFit kind of needed a Lane Norton type figure. That being said, and I'm forgetting what his name is, but the scientist that runs WOD Science he seems like a particularly wonderful, nice individual. I think he's from Switzerland or somewhere in Europe, but he is a must follow for anybody in functional fitness, or that just likes the data.
Yeah.
Next after that, again, no huge surprises, but soccer, middle distance swimming, racquetball. I suppose if you're extremely good, this is supposed to be for, really good athletes. That's a little surprising. And speed skating and wrestling.
Yeah, that's reasonable.
CrossFit is not listed in here, but we did take the CrossFit Games athletes. So last year, Maddie and I went to Madison to go to the CrossFit Games, and they had a 5K run. It was actually 5,000 yards and not 5,000 meters, which turns out to
be to the joy of the CrossFitters.
Yeah, hilarious. America will use anything except the metric system.
Yeah, it's about 50 football fields.
So it's 5,000 or 4,570, something like that. So if you convert all those things and put it in, the average CrossFit Games VO2 max is about 48 to 50 if you use their 5,000 yard time, which puts them along the lines in this middle group of, soccer, speed skating, wrestling. Racquetball just seems odd. I know that.
Well, you're looking at the females there. They're actually.
Oh, that's.
They're more analogous to a baseball player.
Oh, that's true. I did not put in the female CrossFit athlete times, but I know that they have an outlier, Rolf, maybe Emily Rolf.
Taller athlete.
Yeah, taller athlete, and a particularly good runner. She is in great shape. She would dominate a lot of other sports, probably including High Rocks if she did so, or at least do extremely well. That's what I mean by dominate, is you're professional, right? So I suppose it would put them more along the lines of tennis, hockey, gymnastics. Of note, sprinting is here, and CrossFit is a lot about sprinting. So that makes a lot of sense. Also, the winner of note was another tall athlete. He's only 6 centimeters shorter than me, and 5, 6, 7 kilograms less. Gillett Hosta, I believe. And his calculated VO2 max was 55. So
Pretty solid.
yep, excellent for him. But the lowest VO2 max category, of course, is baseball, American football, shot put, Olympic lifting, and bodybuilding. So they have average VO2 maxes. So likely, influencers or scientists in those sports that enjoy those sports will probably write articles about how VO2 max is no good.
Yeah, I'm kind of surprised that the baseball, and I guess shot put to some degree, is on there as well.
You think it would be even lower than average?
I would think so. But I guess they are doing some aerobic work and they're going to be more active than the average person. So it all sort of balances out. Because the reason being that the VO2 max is corrected based on weight. So you think of your shot putters, they're going to weigh heavier. So they have above average oxygen uptake, but because they're heavier, their like uptake per kilogram is not as high or as we would think it would be,
Yeah, I suppose that makes sense. Hopefully that gives athletes a good idea of, what VO2 max can be expected for their chosen sport, and also some of the cardiovascular benefits of cross training. If you're in a sport like baseball or shot put, certainly there's more health benefits to training your VO2 max than if your VO2 max is just naturally high. And conversely, if you're a marathon runner, then certainly strength training is going to have a lot more health benefits than just training your VO2 max even more. So the law of diminishing returns applies.
Yeah, I think that's a great summary. We touched on a lot of topics. We recapped our Gillett Health Games. We'll have another iteration of that next year. We talked about injuries.
Yep.
Talked about VO2 max. You and I should get some VO2 max tests done at some point.
Yeah, I saw Thomas DeLauer dropped a pretty
60.
solid, pretty solid VO2 max score. So, my lifetime best VO2 maxes are calculated at a much lower body weight, so they're not going to be anywhere near as good. I think my calculated VO2 max right now would be around 60 for running. If you use my better mile times, around 5 minutes recently, and then low to mid 60s for rowing using my rowing times. But certainly getting a more accurate measurement just for fun would be good to see.
Yeah, we should do that. So stay tuned for our VO2 max test results.
As always, thank you for your time. Thank you for listening. Please post your VO2 max or your 150 wall ball score in the comments below. And let us know if you like this kind of like a fitness type content. As always, thank you for your time, and may God bless you with health and happiness.